All right, let's dive into a really important procedure, pediatric blood transfusion. It's so much more than just a checklist. It's about being incredibly precise and super safe, especially when we're caring for kids. So let's get right into it. Okay, so we're gonna walk through this in 5 main parts. First up, everything you do before you begin. Then the core procedure itself. After that, we'll talk about vigilant monitoring, how to complete the transfusion, and finally, all the final steps and documentation. Pretty straightforward, right? All right, first things first, before you begin. And this part is huge because preparation is protection. Seriously, every single thing we do here builds another layer of safety for our patient. So let's look at these first few steps, because each one has a super important job. Of course, you check the doctor's order. Gotta make sure we're all on the same page. Then you identify the patient with 2 identifiers. You can't skip this. It's what prevents major mistakes. And then you talk to them, explaining what's happening to the child and their parents. That can make all the difference in easing their fears. And obviously, the basics, hand hygiene and privacy. That's just fundamental respect and safety. Next up, gathering your tools. You really have to get everything you need right there at the bedside before you even think about starting. This isn't just about being tidy, it's about flow. It means you're not running around, you keep everything sterile, and most importantly, your focus stays 100% on the patient, right where it needs to be. Okay, this is a big one, a key safety checkpoint. If the doctor ordered any pre-meds, say an antihistamine, you've got to give it at least 30 minutes before the blood starts. And you might ask why? Well, that little bit of timing can be the one thing that prevents a nasty allergic or fever-related reaction, so it's a huge deal. And now, for what is without a doubt the most critical safety check of the entire process, the 2-nurse verification. This is non-negotiable. You need 2 people, 2 sets of eyes, looking at everything independently. You're cross-checking the patient's name and ID on their wristband, in the record, and on the blood bag label. You're checking the blood type, the expiration date, everything. This step right here, it's our absolute best line of defense against making a terrible mistake. Okay, prep is done, everything's checked and double-checked. Now we get to the main event, the core procedure. This is where we get hands-on, and believe me, precision is the name of the game. First thing we do is prime the line. And here's the key. You always use normal saline to do this, not the blood itself. Why? Because priming with saline prevents something called hemolysis. That's when the red blood cells actually start breaking down. No good. Plus, it pushes all the air out of the tubing and lets you know for sure that the IV is working properly. So just before a single drop of blood goes in, we get a full set of vital signs. Think of this as your starting point, your baseline. It's not just a box to check. This baseline is what you're going to compare everything against. If any of those numbers start to look off during the transfusion, that's your first big clue that something might be wrong. All right, time to spike the bag. You want to do this with a clean, confident, twisting motion. The goal is to get a really secure connection without touching anything that's supposed to stay sterile. Every time you make a connection, you're creating a chance for contamination, so keeping things sterile here is absolutely critical to prevent infection. So, the bag is spiked. Now what? You're gonna gently squeeze the drip chamber. Keep squeezing until that little filter inside is completely covered with blood. This does 2 things. It gets that last bit of air out of the line and makes sure the blood is getting filtered properly before it ever reaches the patient. And we're off. The flow has started. But, and this is a big but, you start slowly, like really slowly. We're talking no more than 25 to 50 milliliters for the first 15 minutes. This is a massive safety net. If a bad reaction is going to happen, it's most likely to happen right at the beginning. By going slow, we make sure that if something goes wrong, we've only given a tiny amount of blood and we can stop it immediately. And that leads us right into what is probably the most intense part of this whole thing, vigilant monitoring. The blood is flowing, everything's set up, but now for the next 15 minutes, your world shrinks down to just you and your patient. Nothing else matters. 15 minutes, that's the magic number. This is the high-risk window, the time when a severe reaction is most likely to show up. That's why you have to stay right there, at the bedside. No charting, no checking your phone, no other tasks. You are there to watch, to assess, to be completely focused on that patient. So what are you actually looking for? Things like The patient getting flushed, having trouble breathing, maybe they start itching, or you see a rash or hives. Any of those are huge red flags. And if you see them, there is only one thing to do, and you do it instantly. Stop the transfusion. That is the single most important thing you can do to keep them safe. Okay, so you've made it through that critical 15-minute window, and everything looks good. Phew. You'll take another set of vitals to confirm, and if they're stable, now you can increase the infusion rate. The big goal now is to get the whole bag infused within 4 hours. And that 4-hour rule is there for a really important reason, to stop any nasty bacteria from growing in the blood once it's out at room temperature. All right, we're on the home stretch now. The blood bag is empty, so let's walk through how to finish this up safely and correctly. So to wrap it up, you'll close the clamp on the blood side and open up the clamp on the normal saline side. Then you let that saline flush all the way through the tubing. This is great because 1, it makes sure the patient gets every single last drop of that precious blood, and 2, it clears out the IV line so it's ready to go if you need it for anything else. The blood is in, but we're not quite done. The final part is all about closing the loop, making sure everything is cleaned up safely, and, just as important, that the documentation is perfect for the next person. And here's that final checklist. You're gonna get one last set of vitals to see how the patient is doing. You'll get rid of the empty blood bag and all the used tubing, following your facility's policy for biohazard waste. Take off your gloves, wash your hands, and then you document everything. I mean everything. What you gave, how much, the vitals before, during, and after, and how the patient handled it. Good documentation is just, it's everything. You know, this quote really says it all, doesn't it? Double-checking minimizes risk and ensures patient safety. That's the whole point. From that tuner's check at the very beginning to staying glued to the bedside for those first 15 minutes, it's all about one thing: keeping our patients safe. And that kind of brings us full circle. We can master the checklist, right? We can know all the steps and all the reasons why we do them. But at the end of the day, there's a child in that bed. So the real question is, how do we go beyond the procedure to actually make them feel safe and cared for? How do we build that trust during something that can be pretty scary for a kid? That's really something to think about.